I'm actually really excited to be here, and thank you, Jennifer, for giving me the opportunity to present on some of the most recent work I've been doing in the area of workplace accommodation. So it's a great pleasure to be here, and I really look forward to hearing your questions at the end of the presentation and some of our discussions. So as Jennifer mentioned, the title of my presentation today is Developing Effective Workplace Accommodations, and we'll be looking at the idea of workplace accommodations from three key stakeholder groups that we felt were really important to get perspectives from. The first were obviously the cancer survivors themselves, providers, and we looked at both health, vocational service providers, as well as insurance service providers, and also being able to build on employer perspectives and employers' experiences in providing workplace accommodations to cancer survivors. So just a quick little slide with regards to the presentation outline. I'm just going to give you a little bit of background information, first of all, to begin on in terms of my program of research, so you have a sense of where I might be coming from. A little bit of an overview of some of the current cancer-specific projects that I'm involved in, and then what I'll spend the bulk of the presentation time talking about is more specifically a recent study that looked at the accommodations piece in greater detail. So in a nutshell, my research goals are really to be able to bring different stakeholders together, because I think the team approach is something that's very important to any kind of successful return to work process, but bringing the different stakeholders together to identify strategies and actually develop tools that will enhance work integration and reintegration with the ultimate goal of enhancing inclusion of individuals across rehabilitation populations. So I'm interested in not just necessarily just one particular rehabilitation individuals with a particular rehabilitation issue or a particular diagnosis, but looking at strategies that work across a variety of diagnostic groups. And to date, I've done some work in brain injury, mental health. I've done some work with individuals who have had electrical injuries, and more recently, some of the cancer pieces. And for me, to just give you a little bit of sense of what I see as important, or a little bit of a guiding framework to kind of enhancing worker integration, I see the whole idea of work and worker integration as kind of following or moving along a continuum. And so I see it as much as a process than it is an end goal that involves a number of kind of interlinking stages. So starting with a period of when individuals are off of work, and whether that means they've been injured or they become ill while they're at work. And I have, in terms of that kind of off at work stage, developed guidelines to help clinicians in traumatic brain injury and also burns be able to determine when people are ready to return to work and making recommendations in relationship to going back to work. And then in terms of the back to work piece, I'm really interested in kind of determining when people are ready to go back to work, what needs to happen from a strategy perspective to facilitate that return to work process, and then what needs to happen more specifically at the workplace to support individuals' ability to stay at work or maintain their work within the context of the workplace. And so most recently, I focused more specifically on that kind of back to work maintenance phase and looking at workplace supports and accommodations, and we started off by looking at it in relationship to traumatic brain injuries and electrical injuries, and more, I'll share with you the cancer piece today, looking at the impact of stigma and discrimination, and also being able to kind of understand what issues might be relevant from a workplace health and safety perspective. And we're looking currently at issues around gender issues for men in high-risk work, and issues for young people who might be more vulnerable in the new labor market and having challenges getting work. So as I have said, I think most of my interests have kind of shifted to being able to understand what happens more specifically at the workplace. And a few examples of some other cancer-related projects I'm involved in. I am involved in developing a vocational self-management tool for cancer survivors. We'll be starting looking at developing a guideline, and this will be more to kind of integrate best practice evidence and practice expertise to assist in that kind of initial assessing individuals' abilities to work and return to work. I am involved with a group who's which is being led by Dr. Christine Mayhew, where we're developing online services, online resources for work and cancer. And the last piece is that I'm involved with Layla Amin, who some of you might know, in evaluating a return to work planning template that Layla has actually developed and is looking at, will be looking at pilot testing at the Princess Margaret Hospital. So on to the focus of today's presentation, where we were, and this is a study that I have led and that Dr. Jennifer Jones has also been involved with at Elixir, Dr. Lynn Holness, who is actually at St. Michael's Hospital, Dr. Bonnie Kirsch and Miss Andrea Duncan, who are here in the Department of Occupational Science and Occupational Therapy, and Mr. Dwayne Van Oort, who is actually a scientist at the Institute of Work and Health. And certainly, last but not least, I wanted to thank Cheryl Pritloff, who's been our research assistant, who has done amazing work in terms of the interviews and assisting me with much of the data analysis. So I'm going to start by just kind of backing up and just reviewing a little bit about what we know about cancer and successful return to work. So there has been research done in the whole area of being able to identify personal factors that are associated with successful return to work for cancer survivors. So we know that age, sex, education, the presence of comorbid health conditions, and the presence of persistent symptoms, particularly pain, fatigue, cognitive dysfunction, and anxiety and depression, have been linked to successful return to work. And there's a body of literature that describes those associations. And there's a little bit of a body of literature that talks about more the environmental support that are important to successful return to work for cancer survivors. And this is probably the piece that I am actually most interested in, and something that I've become even more kind of interested in. So, and what we know in terms of from the environmental perspective is that we know that an accepting workplace environment can enhance a successful return to work process, but we don't necessarily know exactly what a supportive work environment actually looks like for cancer survivors. And we do know that stigma is a concern for cancer survivors, but we don't exactly know how this presents itself in the workplace and how it may affect survivors' abilities to return to work. And while we know that workplace accommodations are a very important form of support, we didn't really have a great understanding of how they were currently provided and what might be the best kind of processes or practices for ensuring how ensuring people's comfort in requesting them, and then providing and ensuring that they're actually implemented. So in the next slide, I just have an example of a definition of workplace accommodations that I particularly like, that essentially defines workplace accommodations as a job or modifications to a job or the workplace environment. And I like this because it doesn't just focus on the individual, but says we want to look at the job as well as the workplace environment that allows qualified job applicants or employees. So the assumption there is that these individuals can do that work, who have an illness, injury, or disability, to participate in the job application process. So from the beginning in terms of applying for jobs, to getting the job, to career advancement pieces, and to perform the essential tasks of the job. So really we're focusing on, the supports that they need to make sure that they can do the work that they are qualified to do. And so what do we know about workplace accommodations currently in relationship to cancer and work? We do know from the larger workplace accommodation literatures that workplace accommodations can enhance successful return to work. And there's a number of legislations, so human rights legislations, accessibility legislations that exist to really protect employees' rights to accommodations. And we do know that lots of employers have become increasingly aware of their duties under these legislations, but employers often find it difficult to really understand how they're going to operationalize the principles in those legislations to actual practice within the context of the workplace. And that we do have a very limited understanding of the types of accommodations that might be most appropriate for cancer survivors and how to effectively identify and implement them more specifically within the context of the workplace. So what we did, as I had mentioned earlier, is in this particular study, we looked at the various stakeholders' perspectives. So survivors, service providers, and service providers that were included healthcare professionals, community professionals who provided supports within the context of survivors' employment goals. We actually had one lawyer who participated from the advocacy kind of perspective, and we also had the perspective of vocational counselors, as well as return to work coordinators who may have been the bridge between healthcare providers and the workplace. And last but not least, we also included the perspectives of employer representatives. And the employer representatives that we included in this particular study included individuals who were working specifically at the workplace and whose primary role within their particular workplace was to assist ill or injured workers to return to work. So in some cases that may have been a direct supervisor, in some cases it may have been the occupational health and safety individual, in some cases it might have been an occupational health nurse. It depended on the workplace context, but we were looking for the perspective of the people who were working more specifically in the workplace. So we had we had a number of study questions, but what I'm going to be presenting today are three primary study questions in relationship more specifically to the accommodations piece. So we wanted to know what types of workplace accommodations are most frequently recommended for and provided to cancer survivors. We wanted to get an understanding of what processes survivor service providers and employers identified as most relevant to ensuring the successful identification and implementation of workplace accommodations. And we also wanted to get an understanding of what challenges they experience when going to provide or for the actual survivors themselves when they were receiving the workplace accommodations following cancer. We employed a qualitative research design, and we did qualitative semi-structured in-depth interviews. Cheryl completed 40 interviews in total, and I actually completed some of the employer interviews with her. The interviews ranged anywhere from an hour to 2.5 hours in length. We were extremely fortunate, particularly with our survivor participants who were very, very giving of their time. We interviewed 16 survivors, 16 service providers, and 8 employer representatives. The interviews are digitally recorded and transcribed, and for anybody who's interested from a methods perspective, we used an inductive thematic analysis approach where we looked at coding and categorizing the data and then identifying key themes across the interview data that would help us to understand our primary research questions. So just to give you a little bit of an overview of who the study participants were. So our survivors included 12 females and 4 males, and we looked at including individuals who had a variety of cancer diagnoses because we wanted to get the perspective of a variety of different cancer survivors, but also because to a large extent we found in the return to work literature and cancer, it tends to be focused mostly on breast cancer survivors, and this was a gap or a limitation that we had identified previously. And to give you a sense of some of the work that some of those survivors had either done previously and had returned to, or some of their areas of kind of more vocational expertise, it also ranged quite broadly from business to technological to teaching to research to management, marketing, sales, so quite a broad variety of occupations. Our service providers included 15 females and 1 male. And as I had mentioned before, this included healthcare providers, vocational service providers, community service providers, lawyers, and rehabilitation consultants. And our employer representatives included 6 females and 2 males, and they included individuals who worked in the human resource capacity, occupational health and safety, some disability management consultant. We had one person who described herself as an accommodation advisor, and managers in some cases, and a rehabilitation team leader. So again, quite a variety of backgrounds. And we asked similar questions to the 3 groups, so we could actually compare our findings, but also took a little bit of a different approach for each group depending on their specific expertise. So we asked cancer survivors within the interviews to first of all give us a sense of what their cancer journey was like, and what their decision making was in relationship to work along different points within that cancer journey. And then to speak about their experiences of working or returning to work, and their experiences with their supervisors and co-workers, and any supports that they requested and received, any modifications or accommodations that they requested, and that they were actually provided within the context of the workplace. So we started fairly generally and then kind of narrowed down more specific to the accommodations piece. For service providers, we asked them to tell us a little bit of, first of all, start to tell us a little bit about how they assist survivors with work-related goals, how they help survivors to determine their work readiness, any concerns that they might have with regards to survivors' abilities to work, how they determine most appropriate accommodations, and then their successes and challenges to discuss some of their successes and challenges within the accommodation process. And employer representatives, once again, we started with asking them how they assist persons with cancer to stay or return to work, and their personal perceptions about survivors' abilities to work, experiences with providing workplace accommodations, once again, some of their successes and challenges, and ended off with a request for them to tell us any recommendations that they might have to give to a colleague wanting to assist a cancer survivor to return to work. And what I want to share with you today is essentially 3 themes that represent some of our key findings with regards to the accommodation pieces and in response to the 3 primary questions we wanted to ask. The first, I'll give you a sense of the types of workplace accommodations that were most frequently described. In the second theme, I'll show you a little bit about some of the processes and strategies that were deemed to be relevant to ensuring effective workplace accommodations. And then the last theme, I'll share with you some of the descriptions and discussions about ongoing challenges that individuals experience with the workplace accommodation process, despite the strategies that they may actually be employing. So types of workplace accommodations, we had grouped into 4 categories. And I think the first category on the top left-hand corner really represents probably the types of accommodations that are most frequently and almost universally discussed, and that is the idea of employing or recommending a gradual return to work plan with some form of kind of flexible scheduling with a gradual increase in the time that individuals are returning to work. The second most frequently kind of discussed accommodation was the idea of modifications to work duties and also modifications to performance expectations. And this was followed by recommendations around some initial time when people return to work to be able to retrain and to be provided with supports at the workplace. And lastly, there was some discussion more specifically for individuals who might have persistent physical limitations, and I think it often came up within the context of lymphedema, for example, where there may be modifications made to the physical environment, so that might be modifications made to the workstation or adaptive aids that may actually be prescribed for those particular individuals. So just to give you a sense, I've just also pulled out some of the supporting quotes, and what you will actually see on these slides, if it says E, it means that this was a quote that came from an employer. If it says P, it's a quote that came from one of our service providers, and if it says S, it means it's a quote that came from one of our survivors. So as employer number 4 indicated, we tend to look at modifications of their hours with corresponding reductions in duties that they might be responsible for, so that they're not trying to do 8 hours worth of work in 4 hours. And we thought this was actually a really important point that when making recommendations, it's important to really scale down the expectations based on the hours that somebody's going to be at work, which makes sense but doesn't necessarily always happen. And as one of the providers said, it's also important for her employer, speaking about a particular survivor, to understand that when the survivor, comes back to work, it would take her time to gradually build up her time at work and her speed. Because of the residual neuropathy in her fingers initially, it would take her longer to type a document. What previously would have taken her 5 minutes might now take her 8 minutes. And I like this quote because I think what it really demonstrates is the importance of being able to make that recommendation about an accommodation in relationship to the job demands. And as survivor number 8 describes the importance of being given some time initially to acclimatize to being back to work, she says, it was a weird feeling being back at work, obviously familiar because I had been there before, but it had been such a long time. It did feel very much like I was starting a new job again, and I was definitely feeling anxious. Having that retraining period did help because I wasn't just thrown back into my job on my own. So just a few examples of the different types of accommodations that were discussed. So in this next slide, what we tried to do is across the 40 interviews, take a look at processes that were described as being relevant or strategies that the different groups discussed as being relevant to ensuring effective workplace accommodations, and try to map this out in terms of kind of steps in the accommodation process. So the first step really that was described as being very important was everybody having really good knowledge with regards to workplace accommodations. And so for some individuals, they found that there was good knowledge. For other individuals, they said that not everybody within the team was particularly knowledgeable about accommodations, rights, and duties in relationship to accommodations. So once that knowledge is there, the second step was to really, for the team to look at establishing a clear idea of the employer's ability to actually provide an accommodation, and getting a clear idea of what possible accommodations were possible within that particular workplace. And then next, in terms of step 3, being able to have everybody sit down and negotiate what they considered to be reasonable accommodations, and then customize those accommodations in relationship to the individual as well as the workplace, and then have a final step of ensuring some method or some processes or plans were put into place where those accommodations would be monitored and changed if needed to be. And to give you an example of a supporting quote in this particular case, the survivor talked about how he came to understand how he should frame his accommodations in terms of negotiating or perceptions about what might be reasonable. And he says, I had taken this workshop and had learned how some requests for accommodations are rejected for some people. So what I've said to myself is, what I need to do is make a case for my accommodation, make sure it's not too way out there, that it's not unreasonable. One accommodation I asked for was a smartphone, because a lot of my work requires me to monitor social media channels and our website on a regular basis. And I didn't want to be tethered to a computer all the time to carry it around. And I explained to my employers, do you mind paying for an iPhone so I don't have to carry a big laptop around on weekends? It makes me more agile in my job, and they accommodated it. So I instilled the fact that I wanted to work for them and that I'm good value as an employee. I wasn't asking for pie in the sky, unreasonable accommodations that would make it difficult for them to provide for me. And a couple of other quotes. This was from our provider number 13. Indicated that the people who accommodations seem to really work for are those who have thought about it in terms of task specificity. In addition to recommending a gradual return to work plan, identify what do you have to do during that graduated period. And as another provider indicated, I recommend ongoing weekly predetermined check-ins. So this idea of having a monitoring plan. So this isn't relying on the survivor and employer alone. I say I want to meet with you, and actually it's scheduled beforehand, so they don't need to make an effort to make a phone call. I call and ask, how are things this week? So the last bit that I want to kind of share with you were some of the pieces that were identified as challenges, and we kind of group these challenges into 4 categories. The first category actually related more specifically to survivors' fears in relationship to requesting accommodation, and interestingly enough, a lot of these fears were identified by both survivors themselves as well as many of the providers. So there were fears around kind of requesting accommodation because people were fearful of appearing different. They were afraid if they asked for an accommodation that their work abilities might come into question, and this may actually lead to job loss. And there was lots of kind of fears or discussions around what this meant in relationship to how they disclosed their need for any kinds of supports or accommodation, and how this could be done in a way where they would get their needs met while also protecting their privacy. There were also a number of challenges described in relationship to developing clear and specific accommodations. So there were discussions around situations where accommodations did not work, and this tended to be situations where the accommodation recommendations were vague, or situations where the accommodation recommendations were not necessarily adequately supported by medical documentation. So that seemed to be a very important part of the equation as well. And then the third category of challenges really tended to focus more on our participants' perceptions of the types of jobs that might be more challenging to actually accommodate. So this included physically demanding jobs, which were viewed as having less opportunity for job modifications, and jobs which were perceived to be high risk. And this could include situations where there was significant consequences if errors were actually made, or jobs that were considered to be high responsibility or high performance. And last but not least, there were discussions around challenges from the perspective of what might actually happen specifically at the workplace or at a workplace organizational level. So these included situations where there may have been strained pre-cancer relationships between the cancer survivor and the employer, or the cancer survivor and coworkers. Situations where there was either insufficient or inflexible return to work policies and practices in that workplace, and situations where employers may be concerned about providing an accommodation because it might be viewed as setting a precedent, or situations where employers might be concerned about, when an individual asks for accommodation, whether that would bring up concerns from the employer from a productivity perspective, and situations where people didn't feel like there was a lot of kind of opportunities to provide modified duties within their particular workplace more specifically. So a few supporting and illustrative quotes, and this was from one of the cancer survivors as she spoke to fears around kind of requesting accommodation. So the very idea of asking for an accommodation, if you were to say that there could be an issue of you doing the job, the employer could say, okay, we're going to ask you to step back from this temporary position right now and have someone else do it. So that sense that, you could be replaced, and if you ask for an accommodation, it may be that you could be more easily replaced. And as one employer indicated, generally this one employer in this particular case discussed a lot of the challenges from an employer's perspective when accommodations were not necessarily very clear, or when they didn't make sense or they were vague. So this employer said generally the restrictions come from the clinician, from the physician. Physicians, I know, sometimes are giving their best guess, but I have also seen physicians write restrictions that make absolutely zero sense. I had one yesterday which management was quite alarmed about because it would impact how they assigned work. It indicated the survivor could not wear street clothes, but must wear coveralls. I guess there must have been some coveralls within that context that needed to be worn, supplied by the employer. And I'm like, well, they have to wear street clothes to get to work to wear the coveralls. So it's not making a lot of sense. So the situation where the accommodations really didn't make sense according to either the job tasks or according to kind of the workplace context that individual would be returning to. And this was actually interesting. I pulled these two quotes because this was around the perceptions about the types of jobs that could be accommodated. And in this particular case, there was one provider and one employer, and they're actually talking about the same job or category of job. They're actually talking about nursing in this particular case, but they have very different perspectives of whether a nursing job can be accommodated, and I think speaks to the importance of understanding that job in that particular context. So provider 6 said, there are some jobs, like say you work in a pizza store and you can't flip a pizza. What are you going to do? It's not like a nursing job where there's this perfect role that you as a nursing resource person where you can do blood work or give out information. That's like an easy thing that you can do. There are not always substitute jobs for every position. And in contrast, employer number 4 said, those nurses that present with some cognitive limitations, sometimes you are unsuccessful in being able to accommodate them. Healthcare are a risk-sensitive or safety-sensitive job. So if they present with significant cognitive issues related to judgment or attention and concentration, it poses some difficulties in being able to place people safely. In terms of the cognitive limitations, I would say that we have not been successful in placing someone who has a professional background. So nurse or an executive member, if they have those kinds of limitations. So just interesting in terms of the different perspectives of what can and cannot be accommodated. And so just in terms of thinking about the bigger picture and some key kind of discussion points, I think I would say that we saw lots of positives within the context of our data and what people were telling us. So I think there is some good general awareness of the need and potential benefits of workplace accommodations. I actually found with this particular study that at least amongst the individuals that we interviewed, there seemed to be a better understanding of accommodations than we found when we did the accommodation study within the electrical industry, for example. But anyway, so that there seems to be some general awareness. And some accommodations are, in fact, being recommended and implemented. And if we take the idea of the graduated return to work plan, this I think has become fairly standard practice, and everybody knows that is a very beneficial and helpful accommodation. But I think there are some key kinds of gaps or some key kinds of struggles that continue to be an issue within the context of accommodation. And the first gap is, I think, there still tends to be some challenges in the clarity in how medical restrictions are identified, and also the specificity of the accommodations. I think the second key, and I think this is a really, really big kind of concern, is the fear related to stigma, and how this affects individuals, comfort and then requests for accommodation. And I think in relationship to cancer and cancer survivors, I think another big thing is that I think there still tends to be not necessarily a strong recognition that survivors' support needs may be ongoing. And often a lot of survivors, one of the biggest challenges they talked about in terms of receiving ongoing accommodations was having their psychosocial accommodation needs met, and being able to take time off work to continue to participate in psychosocial or peer support groups seemed to be a big area that many of them found was really, really necessary, and the realization that perhaps their cancer journey is still continuing and they may still need kind of support even once they return to work. And on this slide, I just wanted to acknowledge the University of Toronto Faculty of Medicine, and it's a Dean's Fund that actually supported me and the team in completing this research. I'd like to extend our appreciation to all of our study participants who shared their experience and expertise, and particularly I want to thank Wellspring for their assistance with recruitment. It was a wonderful response from them, and also a wonderful response from the survivors who are members of Wellspring as well. So thank you all for that.